Is the screen visible to you all?
Yes, it is visible, ma'am.
Okay. So if anyone will be waiting now, just do inform me because I may not notice who is in the waiting room. And I want all of you to please put your mics on if you are at some silent place so that you can respond to any type of question, because it will be, I want it to be a two-sided discussion instead of just myself telling some things. Okay. So put your mics on and do respond. So students, I welcome you on this GRF tutorial class about principle and uses of radiological techniques in the diagnosis of animal disease. So basically we will discuss about veterinary radiology. Okay. So because we have just one class for this lecture and time will be short, so we will not go into depth, but I will just brief you about the topics which you must read so that you can cover the important questions from this aspect. So you must be knowing about the general introduction where there will be some terminologies wherein you will encounter what are X-ray, what is radiography, radiologist, etc. and etc. There are various terminology which you must be knowing. You should just go through briefly about the historical perspective of development of X-ray. There are various type of radiations. You must be having a brief idea about different types of radiation, their properties of X-ray, where they are used, their applications. You should be knowing what is photoelectric effect, what is Compton effect, and as we all know that these X-ray, they are absorbed into the tissue, and based on that the intensity reduces, they get attenuated. Okay, so these are some of the terms you must be knowing. Then you should be knowing about the component of X-ray machine, different components, which is the cathode side, where is the anode side, how the X-rays are produced, how the electrons they move from cathode towards anode, what is that envelope, glass envelope and tube housing, what is their importance, what elements they are made up of, okay, and why, what are the properties because of which the cathode is particularly of some element and an anode of some other. Then you should be knowing how these electrons they interact with the target. Then there are maybe characteristic radiation are produced or Bremsstrahl and radiations are produced. So you just go through these topics in brief. Okay. X-ray emission, what are the factors which will affect the quantity and quality of the X-rays produced, and what are various type of X-ray machine, what will be their maximum kVp and MAS produced, and in which scenarios these type of machines will be used. So some type of questions may directly come from these easy things. You should be knowing about image formation. When an image is formed, there are certain processes which are affected. That object, because we know object is a 3D subject and the image is formed in a 2D. So there will be some changes. The image may be magnified or distorted, or there may be less sharpness. Okay. So what are various factors which affect the magnification of the image, the distortion of the image, and the unsharpness? This unsharpness is also known as penumbra. So you should be knowing about those factors. Then there is X-ray film. There are various layers of those X-ray films. You should be knowing briefly about the composition of that, what crystals they are made up of, and what is the utility of screen and non-screen film. What is difference between intensifying and non-intensifying screen. Then if we talk about quality, the quality is affected by its detail, density, and contrast. So you must be knowing what is detail, what is contrast, how they affect the quality of image. And when X-rays are produced, some will be the primary beam, and apart from that, there will be some scattered radiation. So these scattered radiation, they just simply create fog. They are unwanted radiations, and they have hazards also. So there are various measures by which these scattered radiations can be controlled. So you must be knowing about those devices for control and what are the factors which affect the scattered radiation. And then, previously when the X-ray, they were developed conventionally, there were various stages, developing, washing, and fixing. So all of them, they had different type of solution. You must be knowing what is the developer solution, main ingredient in the developer solution. There are many components. Each component has its own action. So you must be knowing if there are 5 components, what is the developing agent, what is the preservative, like this, huh? Then when the image is developed, there will be some faults. Either the image will be very white or it may be very black. So what were the reasons why the image is not properly formed on that film, and how, what control measures can be adopted to prevent these radiographic faults? Then obviously we know that these, because they are ionizing radiation, so they have their own hazards. They can have biological effects, which can be somatic or they can be genetic. They can be direct or indirect. Some effects can be observed very acutely and some may be transmitted chronically. Okay? So to prevent these hazards, we need to adopt some radiation protection measures, which are various protection measures. And if we talk about radiation, there are various units. Some will be SI unit, normal unit, what is CVR, what is Curie. So all these you must be knowing. So this is just like, I'm just covering the means I'm just brushing up what is the entire syllabus of veterinary radiology. I'm just briefing it here. Okay. Then it is not that the radiations are there just used for diagnostic purpose. They are used for therapy also. So when we use radiation as therapy, then there are various terminology like radio sensitive, radio responsive, radio curability. What is neoplasm lethal dose? What is normal tissue tolerance dose? What is therapeutic ratio? There are 4 hours of radiotherapy. You must be knowing, like they can ask which of the following is not a R. So if they will give the 3 correct R's and 1 additional some R, okay? So like that you should be knowing. There are various techniques that brachytherapy is there, teletherapy is there. So all these are technique of radiotherapy. You must be having brief information about them all. Contrast radiography, a very important topic in which contrast agents are used. What is the property of contrast agent? How a material, it will be classified that yes, it is a contrast agent. What is a positive contrast? What is a negative contrast? Okay, some are ionic, some are non-ionic. So based on that, you should be knowing. They can simply come as classification question on objective basis. Then where these are various contrast radiography technique, they can directly be asked. Like they can ask what is decrocystorinography, what is myelography. So all these techniques, they should be, you must be knowing them by their name, that what are these contrast radiography techniques. So then there are particular conditions. Suppose I have written just 4 of them, but there may be multiple other conditions which have their own specific radiological signs. So you should be knowing if there is rickets, what type of sign will be there. If there is a fracture, how it will be looking. If there is non-union, so how it will look. There is a characteristic sunburst appearance. It is seen in case of osteosarcoma. So if there are pathological changes of the radiograph, pathological signs, which just state, yes, that they are very diagnostic, then you must be knowing about those radiological signs. Okay. So this was just like to brief you about the syllabus so that you just get a hint out what is the entire syllabus of veterinary radiology. Now proceeding, because in the short span, the best way to revise is going through objective type of questions, because these type of questions will only be asked in your exam. So we will start with the questions, and I believe that you will be answering them. Okay, I'll just show the screen and then you should volunteer to answer. So first question is, which type of radiation is most commonly used in diagnostic radiology for animals? Answer it. And I want it. Yeah, X-ray radiations.
X-ray.
Right. All of you are very right. Then what is the primary purpose of using radiograph in veterinary medicine? Why they are used?
B.
B.
To view
the
internal
internal
structures.
Internal structure.
Right. Then which of the following is a principle of radiographic imaging?
Emission.
What?
Absorption.
Absorption, yes. Because
Absorption.
based on absorption, there will be attenuation. So it works on the principle of absorption. Next, radiopaque substance. What is their appearance on radiograph?
White.
White.
Give example of radiopaque substance.
Stone.
Bones,
Stone.
metals.
Okay, ठीक है, bones. So it will metal, they will appear white. Next slide. Which of the following best describe the term radiolucent?
B. Allows access to pass through
B,
any
ma'am.
present light.
Who is saying C? Anyone said C? Okay, so the correct answer is B only. It allows the X-ray to pass through them and they appear black. Next question, what is the primary imaging modality for evaluating bone fractures?
Radiography. C.
Right.
Radiography.
Radiography. Next is which component of the X-ray machine generates the X-ray?
Anode.
No,
Cathode.
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 C.
The X-rays, they are generated on the cathode side and they travel towards anode side, okay? The electrons, they will be produced from cathode and they will move towards the target anode, okay? Next question, in a radiographic image, how do areas with high tissue density appear?
Light or white.
White, right,
A.
right. What does the term KVP in radiology stand for?
A kilovolt potential.
Kilovolt?
Potential A.
No, it is not potential. It is kilovolt peak. Okay. So you had an idea, but see, just with potential and peak.
No.
Kilovolt, वो तो potential difference kilovolt से है. P signifies peak. Okay. Next is which part of the animal's body typically requires higher KVP setting for adequate imaging?
Skull.
No.
Abdomen.
Abdomen. Then is there any justification? Who will justify this answer?
Ma'am, because of
Higher
greater
KVP
surface
means
area of
higher
abdomen.
penetration.
Higher penetration is one thing, but we don't want higher penetration for soft tissue structures, na? Who else was supplementing? Dekho, see, if there is thorax, then there is air in that tissue. So air in itself is providing contrast. Okay. And if we talk about limbs and skull, then it is made by hard object. But when we come to abdomen, so in abdomen, all the organs, they are almost of the same density. So to get a good scale of contrast, we need higher KVP settings in the case of abdomen. क्योंकि वहां तो सब एक जैसे हैं. ठीक है? In thorax, there is air. Air will provide you contrast. You will get to see this is black, this is gray and white like that. But in abdomen, all the organs are almost of similar density, radio density. So for getting good quality image, we need higher KVP settings in case of abdomen. Next, what is the main concern with exposure to ionizing radiation in veterinary radiology?
Genetic damage.
Genetic damage.
Yes, genetic damage, because it will be carried forward to further generations. Next, which personal protective equipment PPE is essential for veterinary staff during radiographic procedures?
Lead
Lead
apparatus.
Lead aprons, right. What is the recommended maximum occupational exposure limit for a veterinary technicians handling the radiographic equipments? For a veterinary technicians, how much radiation can be recommended? Maximum, not recommended, it is a maximum limit.
B. No idea.
No idea? Okay,
No.
it will be 50 millisieverts per year, okay? So see, you have to ensure the units also. It is 50 millisieverts per year for a veterinary technician. So based on that, you must be knowing this. This will be covered under the topic radiation hazard and safety. Okay. Next, which of the following is a method to reduce radiation exposure during radiological procedures?
B, ma'am.
B. Using collimation. Okay. What
B.
are collimators?
Collimation.
Collimator क्या करते हैं?
Scattering से रोकता है मैम.
Unwanted
Scatter radiation.
radiation.
वो फील्ड को कम कर देंगे only to the region of interest, area of interest, and that is why they will reduce the scatter radiation. Next, the inverse square law in radiology states that the intensity of radiation
B decreases with the square of distance from the source.
B, right? Inverse
Yes, ma'am.
means intensity is decreasing. As the distance increases, the intensity will decrease. And because it is a square law, so it will go with, if there is twofold decrease, then the intensity will increase by 4 times, square times, okay? What is the purpose of using a dosimeter in veterinary radiology? क्या करता है डोजीमीटर, क्या करता है?
मैम सी
And
C.
B. C, okay.
B, C na, their options can be eliminated very easily. B means to the dose of medication. In radiology, there is no medication is given. It is about the
Yes.
exposure level. We can know the
Exposure.
exposure level. Next, which safety measure is most effective in reducing radiation exposure to the animal patient?
I'm
C.
not sure,
Someone
but
said
C.
C.
C, ma'am.
Actually, by increasing
A or D.
KBP, we get good image, but we don't have to unnecessarily increase the KBP settings. Okay. So for that, we have to use the lowest effective dose. It is not like कि हमें
Effective.
बढ़ाते जाना है. जितना lowest पे effective dose आ जाए, वहीं पे हमें रुकना है. So the correct answer will be A. The most
A.
appropriate one will be A. Next, which of the following regulations govern radiation safety in veterinary practice in the United States? Hmm?
NRC है
C
Yes,
and RC.
NRC is the correct answer. Next question, which device helps to focus the X-ray beam and reduce scatter radiation?
great.
Collimator.
Collimator. Collimator is the correct answer. What is a common immediate effect of acute radiation exposure?
Mutation.
Genetic mutation C.
Mutation. C.
Genetic mutation, it cannot happen immediately, na? And it will
Oh.
occur with chronic radiation. It is asking about most common immediate effect of acute radiation exposure.
B
Yeah,
ma'am B. No there.
Hair
हाँ,
loss.
नहीं
Nausea, who is
Yeah.
saying nausea?
SP.
The correct answer is nausea, okay? It is seen most immediate.
information.
Which imaging technique is most suitable for viewing soft tissue in animals?
Ultrasound.
Ultrasonography.
See other options also. It is not just ultrasound. There are other good options also.
MRI. B. MRI.
MRI. What is MRI?
Magnetic resonance imaging.
Magnetic resonance imaging.
So it is more sensitive. Jitna soft tissue hai na, suppose if we have to go and view brain, spinal cord, details of that also. So MRI is the most suitable. Next, what is the primary use of fluoroscopy in veterinary medicine? Fluoroscopy pata hai?
No, ma'am.
No ma'am.
Fluoroscopy use X-ray radiation itself. ठीक है? X-ray radiations को use करते हैं, but it works on different principle. तो इसके अंदर real time जो हमारे moving structures है, suppose we have to see blood vessels or other organs like intestine which is having peristalsis. If we want to view them, then fluoroscopy is used. So it allows the real time imaging of the moving structures like blood vessels. But it has immense, because ionizing radiation, they are used in more numbers. So it has radiation hazards. So it is very less commonly used, only for experimental purposes. Which of the following contrast agent is commonly used in veterinary radiology to enhance the visibility of GI structures?
Barium.
Barium sulfate, right? So if I'm asking about one question, then there are other options. Then you should correlate that if there is gadolinium is mentioned, in which technique gadolinium is used. If technetium is mentioned, where it is used. If iodine is mentioned, in which situation it is used. If we are performing myelography, which contrast agent will be used? So other options you have to rule out. You have to think about them also. Next question is CT. CT is especially useful in diagnosing conditions involving which part of animal's body?
Bones and joints.
Right, bones and joints. Next question, which imaging modality is preferred for detailed imaging of the brain and spinal cord in animals?
MRI.
MRI, right?
MRI.
Next, which imaging technique uses sound waves to create image of internal structures?
Ultrasound.
Ultrasound.
Right. Which of the following is the primary benefit of using MRI over CT? Because they both are good for detailed analysis, but what is the advantage of MRI over CT for soft tissue imaging?
B, ma'am.
No,
C.
Higher resolution.
MRI is not, it
Higher
does not
resolution.
carry resolution for bone imaging. No, it is not. CT has
C.
better resolution for bone. And the advantage is it
Non-ionizing.
works on magnetic resonance. Okay? So no ionizing radiations are involved in MRI. However, in CT, lot many radiations are involved. Okay. Next question, which imaging technique is best suited for detecting abnormality in blood vessels?
Angiography.
Angiography.
What is the role of contrast media in radiographic imaging?
C. To enhance the
C, ma'am.
visibility of specific structures.
Right. Which imaging technique is most useful for evaluating the function of heart in real time?
Echocardiography.
Echocardiography.
Right. What is the primary diagnostic use of thoracic radiography in animals?
B, ma'am.
Evaluating lung.
Evaluating lung and heart.
Evaluating lungs and heart condition.
Right. Then which radiographic view is typically used to evaluate hip dysplasia in dogs?
Ma'am, BD,
Ventrodorsal.
Ventricular.
Ventrodorsal view. Very right.
Ventricular.
Next question. In which condition would you most likely use contrast radiography?
Ma'am,
VIP
B.
blockage.
Gastrointestinal
GI
blockage.
blockage.
Right.
Right.
Gastrointestinal
Right.
blockage.
What does an echocardiogram assess in veterinary patients?
Cardiac function.
Cardiac function.
Cardiac function.
Which imaging technique uses radioactive substances to assess organ function?
Ultrasound.
Nuclear scientific.
Radioactive
D.
substances. Ultrasound use sound waves. High
Nuclear
frequency sound waves.
scintigraphy.
D, ma'am. D.
Nuclear scintigraphy.
Nuclear scintigraphy, right?
D.
So
Yes.
in detail, you must be knowing now which substance is used and like that. Okay. So you just go through deeply also. We are just covering very superficial so that it covers a vast aspect. What is the primary use of dental radiography in veterinary medicine?
Diagnosing periodontally.
Right.
B.
Okay. Next question. Which condition in horses is commonly diagnosed using radiography?
Laminitis.
Laminitis.
Colic.
Can anyone colic? No, abdomen radiographs are not very commonly performed. So for laminitis, what is the characteristic finding? How you will diagnose?
फ्लोटिंग करता है मैम फ्लोटिंग अलग अलग टाइम पे रेडियोग्राफ अलग अलग
रेडियोग्राफी में फुट से रिलेटेड इसके अंदर चेंजेस
मैम वो पेडल ऑसिलेट्स वो टर्न ट्विस्ट कर जाते सर बोल रहे थे एक्यूट और क्रॉनिक वाले
थर्ड
पता
जो
नहीं श्योर
थर्ड
नहीं
वो है हाँ देयर विल बी टर्निंग so like that also if there are characteristic signs then you must be knowing them properly. Okay, then next question is what does the term myelography refer to in veterinary radiology?
मैम इमेजिंग ऑफ स्पाइनल कॉर्ड यूजिंग contrast media.
Right. Next question is which imaging technique is preferred for diagnosing intervertebral disc disease in dogs? IVDD.
Radio.
CT scan.
MRI.
हाँ,
MRI.
CT scan.
CT scan.
Now for this we are getting multiple opinion. IVDD means spinal cord. The technique for brain and spinal cord. Correlated like that.
MRI.
MRI.
Huh?
MRI.
MRI, right. What is the main advantage of digital radiography over traditional film radiography? DR का क्या advantage है?
Faster
Traditional
image
film,
acquisition and processing.
Faster में हाँ B.
right?
Option B.
Because traditionally there were steps involved with film processing, but all these steps are avoided in DR, digital radiography. Next question: which imaging modality provides cross-sectional image of the body using X-ray and computer processing?
CT scan.
CT scan.
हाँ,
CT scan. What type of imaging is most commonly used for initial evaluation of fractures in animals?
Radiography.
Radiography.
Which imaging technique is often used to guide biopsy procedures?
Ultrasound.
Ultrasound.
Ultrasound guided biopsy. In veterinary radiology, what is the term for a radiograph taken from front? Front means from the ventral aspect, okay? A radiograph taken from ventral to the back of the animal.
Ventrodorsal.
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 Right. Which imaging technique is best for evaluating abdominal organs in animals?
CT scan.
नहीं US.
CT.
Ultrasound.
Abdominal organs. Ultrasound.
CT scan में.
What is the primary use of contrast enhanced CT scan in veterinary medicine?
Imaging soft tissue.
हाँ, देखो ये CT के ऊपर this is another term. It is not a simple CT scan. It is contrast enhanced. Okay. So it is used for imaging of soft tissue masses.
आपने कहा मैं आपने कहा था कि सॉफ्ट टिश्यू के लिए सीटी स्कैन करते हैं तो फिर ऊपर वाला आंसर में
नहीं,
सीटी
नहीं।
स्कैन क्यों नहीं हो सकता?
मैं ये बोलूँ this is contrast enhanced CT scan है. इसके अंदर contrast agents are used. Contrast agents are used for CT scan. So it is used for imaging of soft tissue masses and for evaluation of abdominal organ. Most commonly जो use होते हैं वो ultrasound use करते हैं, ठीक है? ये बात बताओ, we are left with 9 minutes only. तो अगर ये क्लास खत्म हो जाएगी, should I continue further again till 5?
Yes. Yes, ma'am.
Okay.
Yes, ma'am, we can.
Okay. So next question: which imaging modality is least effective for imaging soft tissue?
Radiography.
Radiography.
MRI.
अरे MRI इतना अच्छा है for this
Radiography.
purpose.
Radiography.
Who said MRI? बताओ which imaging modality is least effective for imaging soft tissues?
Radiography.
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 ठीक है? Because CT also gives us some idea. Next question is, what does the term radiopharmaceutical refer to in nuclear imaging?
Nuclear imaging. Radioactive compound is diagnostic.
C. Radioactive compound used for diagnostic. C.
C, ma'am. C.
रेडियोफार्मास्यूटिकल, फार्मास्यूटिकल से देखो
ए हो सबसे ए हो जाएगा. हाँ ए हो जाएगा.
कंफ्यूज हो रहे हो?
C लग रहा है.
ए और सी मैम कंफ्यूज.
C is the right answer. ठीक है? Next question, IVP, intravenous pyelography is radiographic technique used to diagnose
cystic. नहीं हाँ
ये तो
Bladder.
Urethral.
हाँ
पायलो मतलब तो ब्लैडर होगी नहीं वो तो
Bladder.
कैलकुलेट
See, as I told ना,
पायलो
technique का खुद से नाम है डेक्रोसिस्टोराइनोग्राफी. So whenever the name is there ना, intravenous pylography, तो renal pilus जो है उसके ऊपर that kidney function, all the kidney function are evaluated through it. इसीलिए पता होना चाहिए तुम्हें किसी टेक्निक को, ये डायरेक्टली सीधा किडनी फंक्शन के साथ ही कोरिलेट करता है. Then biological effect of X-ray used for treatment of cancer is based on its affinity towards
मैम बी फास्ट मल्टीप्लाइंग सेल्स
fast multiplying cells.
Fast multiplying cells.
Then in radiographic parameters, one of the following is considered constant.
Part
Part
film
film
distance.
distance.
Part film distance, right? What is the difference in intensity across the X-ray beam is called
Hill effect.
Hill effect.
हाँ
The penetration power of X-ray beam, it depends upon
KVP
Kilovolt
KVP.
peak.
Higher the KVP,
Higher the penetration.
higher
Higher
the penetration power. Quality of radiograph depends upon
All of the above.
all of the
All of
above.
the above. So,
In an X-ray machine, the radiation intensity is higher in
cathode.
Cathode.
So is it
Hmm.
somewhere related to Hill effect?
40% ज्यादा आता है cathode side पे as compared to anode. That is called Hill effect.
That is called Hill effect, right? Cystography is contrast radiography of
sorry urinary bladder
urinary bladder. Sometimes we will make very silly mistakes. हाँ, जैसे किसी ने फटाफट से गॉल ब्लैडर बोला, वैसी गलती बहुत कॉमन है हो जाने की. तो even if the questions are simple, do not make these type of mistakes. Okay, read the question again and then only answer. Next is most radiosensitive body system is
Reproductive.
right reproductive system. And pulse echo principle is used in
Ultrasound.
ultrasound, right? In X-ray production, energy distribution is
first option
yeah, only 1% X-rays are produced, and
Yeah.
rest 99% of the energy is dissipated in the form of heat. A good quality radiograph should have image with
Good detail.
All the three.
All of them.
डिटेल नहीं, अच्छा होना चाहिए, डेफिनेशन भी अच्छी होगी, डिटेल भी, एंड देयर शुड बी अ प्रॉपर स्केल ऑफ कॉन्ट्रास्ट. ओके, डिटेल्ड सॉफ्ट टिश्यू कैन बी सीन इन व्हिच डायग्नोस्टिक मेथड? सॉफ्ट टिश्यू के लिए सबसे डिटेल्ड स्ट्रक्चर्स अगर देखने हैं तो
CT scan में
नहीं, सॉफ्ट टिश्यू के लिए सबसे बेस्ट है डिटेल देखने के लिए एमआरआई. एमआरआई इज द बेस्ट. ओके, contrast radiography of spinal cord is
myelography
myelography. Object film distance is how much?
0
Zero. The object should be very
0.
near to the film so that there is minimum magnification. Okay,
मैम वो ऑब्जेक्ट फिल्म डिस्टेंस और पार्ट फिल्म डिस्टेंस मतलब
both are the
इंटरचेंजेबल
same
मतलब सेम ही
things.
टर्म है.
हाँ, ये सेम चीजें हैं. पार्ट मतलब ऑब्जेक्ट और ऑब्जेक्ट फिल्म डिस्टेंस, ये दोनों सेम चीजें हैं. प्रिंसिपल इंग्रेडिएंट इन डेवलपिंग सॉल्यूशन
डेवलपिंग
Metol.
पोटेश
Metol.
मेटॉल, राइट. तो ये किसका क्या काम करता है? मेटॉल क्या काम करता है डेवलपिंग सॉल्यूशन में?
वो मैम वो
करता है.
मेटालिक सिल्वर को रिड्यूस शायद
वो वाला स्टेप डेवलपिंग में नहीं होती है, वो फिक्सेशन का स्टेप है. ओके, दैट इज अ पार्ट ऑफ फिक्सेशन. अभी तो डेवलप होगा. हाँ, जितना एक्सपोज्ड है दैट, यस यू आर राइट. फिक्सेशन में रिमेनिंग पार्ट इज वॉश्ड ऑफ. ठीक है, यू आर राइट. सो इट इज मेटॉल. नेक्स्ट क्वेश्चन, बेस्ट प्रोजेक्शन फॉर इमेजिंग द पेल्विस?
वेंट्रोडोर्सल
Ventral dorsal view. X-ray were discovered by?
It is.
X-ray were discovered by?
It is. 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 It is.
Röntgen.
B.
Röntgen. Ultrasound scanning of image of fluid.
Fluid.
Fluid कैसा दिखता है?
Hypoechoic.
काला मैम हाइपर
Fluid say urinary
Anechoic.
bladder.
Anechoic. Anechoic.
ठीक है? Anechoic. Grid is used when the thickness of body exceeds
10
कब यूज करते हैं ग्रिड?
10 centimeter.
10 सेंटीमीटर से ज्यादा जब थिकनेस होती है तब यूज करते हैं टू प्रिवेंट द स्कैटर रेडिएशंस. KVP setting in an X-ray machine decides
So,
Quality.
quality of X-ray. Higher the KVP, higher will be the energy, more will be the penetration power. ठीक है? Father of radiology,
Röntgen.
yeah, Röntgen.
A.
बताओ. Now
वो
we are
तो
getting confused.
Berlin Veterinary Radiology.
Right. R. Berlin is father of veterinary radiology and father of radiology is William C. Röntgen.
Röntgen.
Next question, father of veterinary radiology.
Berlin.
An increase in KVP setting
Increase
Increases
penetration.
penetration.
increases penetration. ठीक है, most of you were very aware with these type of questions, but they were very superficial. ठीक है, in depth नहीं है, but it has covered a majority of aspects. Things will be related like this only, so just go through them, okay? And now meeting is almost ending. We have covered most of the topic also, so I just wish you all the best for your preparation phase.
Thank you.
Any doubt?
No.
No, ma'am.